Hello and welcome to the TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about diabetes. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode is for people with diabetes, their families and carers, health and social care staff, and anybody who has an interest in the health needs of people with diabetes. We will speak with experts from the HSE's Chronic Disease Management Hub here in Tallaght, who specialise in diabetes support and management, and our own experts in the Diabetes Day Centre at Tallaght University Hospital. This Let's Talk About Diabetes series has been brought to you by TUH in partnership with the Healthy Communities Development section of South Dublin County Partnership. My name is Valerie Twomey. I am a clinical neuropsychologist and head of psychology at Tallaght University Hospital. I also work directly with patients in the TUH Diabetes Day Centre. In this episode of Let's Talk About Diabetes, I am delighted to welcome Noelle O'Keefe, Senior Counselling Psychologist at Tallaght University Hospital. And today we're talking about diabetes distress and the psychological impact of having diabetes and the challenges that people with diabetes can face. Welcome, Noelle. Hello, and thank you for joining us today.
Hello, Valerie, and thank you for having me.
It's lovely to have you here today. Can you talk to our listeners about what the psychological factors are involved when a diagnosis of diabetes occurs?
Absolutely, Valerie, thank you. I think one of the initial things that occurs when there's a diagnosis is that of shock. So while you may have gone for the examination and it might have been muted, the actual acknowledgement that there is a physical condition in your body that needs further management does have a shock within people. And I think people need time to let that settle. I think what can arise for people is fear. It is something that's unknown. It might be unpredictable. So I think that arises in people. Initially, I think there can be a real desire in people to have a capacity to control. So when you are put in a situation where you do not know the landscape, it's new, it is natural for humans to seek information, to speak to other people, to try and garner some level of knowing what is this new world that I'm stepping into. Because I think for many people, they are entering a stage of uncertainty and unpredictability. And humans don't do very well when we don't know what's going to happen next. So it shakes people up a little bit like a snow globe where you shake it. And there are elements that help that snow to drop down. Another thing I think that happens when people are receive an initial diagnosis is their connection to others is, I suppose, elucidated more. Who is my new tribe? Who is the diabetes person, in my life? Who's my clinical team? And I think it also comes through there is people's personality patterns. So if I am someone who is really quite good in life at seeking support, connecting with others, getting a diagnosis may be a little easier for me because I know where to reach out. If I am someone who does a lot of things on my own, I'm a real coper, I just think I can manage things, that may be a lot harder to stretch out to others and get some support. And the final thing I would say at diagnosis stage is the psychological mindset of the clinical team. So I think how information is transferred at the diagnostic stage is really important, that there is containment, there is confidence by the clinical team that this is a condition that they will support the person in managing. I think if a clinical person is feeling very burnt out or tired, that gets transferred to the patient. So I think at diagnostic stage, it is a dual responsibility and a dual partnership, I suppose, in how that diagnosis lands into a person.
And it's wonderful to hear you talk about that partnership. We've heard about it in previous episodes today. We've been talking with dietitians, we've been talking with podiatrists, nurse specialists today, and we've also had a patient living with diabetes speak to us in our podcast series. And she really talks quite openly and honestly about the support from her family in particular, the support from the clinical team, and about having that, relentless support from people in helping her to adjust to that diagnosis. As a person living with diabetes who maybe isn't as open to asking for that, what would you suggest that they could do to maybe help inform or understand their new diagnosis?
I think that when the clinical team is getting to know a newly diagnosed person, they need to get to know all those elements I spoke about in terms of how is this person likely to ask for help? And if they aren't asking for help, how do you reach in? So I think it's good that it's been mentioned about the kind of the dual partnership, because there's a term, in healthcare, self-management. And whereas with diabetes, I would think of shared management. So if if a clinician has a patient where they're noticing that the calls are not coming in or the questions aren't being asked, they may need to preempt those calls. They need to, stretch out and, I suppose, offer suggestions of other ways that maybe they'll go online. Maybe they'll get a call next week from the nurse practitioner or the psychologist. But I think where a person might be cautious to ask for help, then we need to offer support. And I would have a distinction between those words, help and support. I think help may feel a little needy sometimes, whereas support this is part of the package. And it's the package that the clinical team are also offering. So I think there is an onus on seeing the whole individual and the personality and what type of person has gotten this diagnosis and the types of ways they need to be interacted with, maybe.
And this person who is now going to learn and adapt to living with having diabetes in their lives.
Absolutely.
And that leads me nicely into my next question for you. I'm looking forward to hearing you talk about the good psychological principles that you would bring that we need to bear in mind in learning to live with diabetes. What would you tell our listeners today? What are those principles?
For me, I think one of the initial ones is the perception that somebody has about their condition. So we know that the illness perception is a big determinant about management. And of course, diabetes is around a long time and people have heard various different stories and how treatment has progressed. But I suppose there's something about, if I describe to patients, it's like someone has come to live in your house. You didn't necessarily ask for them, and it may be somewhat of a surprise, but they've come to live. So I suppose it's a little bit of, how does a person recognize this diagnosis, this condition is living in my house? Am I going to treat them as an unwelcome guest every single day of the years? Or am I going to recognize they're now part of the family? We don't need them taking over the family, but we need to accept that they're at the dinner table, they're going on holidays. So I think the perception that somebody has about the condition is a big part. Is it a terrible thing? Is it something that they will adapt to? Is it something that other people live reasonably with? So I think that's a very important piece. And I think, again, the clinical team is useful in supporting people with that. I think another thing that's useful in terms of living with it, I would view it as an ever-evolving diagnosis in some ways, because throughout somebody's life, how they live with diabetes changes. So a child moving from a child service to an adult service, there's a transition period there. It's another type of diagnosis in some ways. Perhaps if somebody's living at home or they move to live in college, how they manage their diabetes may be new again for them. Maybe somebody who's pregnant or wanting to get pregnant, how they manage that. Diabetes means different things at different times in people's lives. So for me, there's a constant reconnection, a constant engaging in the relationship over and over with diabetes. So I think knowing that can be really helpful, that it's not black and white in some ways.
And we're hearing a lot about improvements in diabetes services in general within the HSE and here at Tala University Hospital. So people are living well, living longer, aging well with their diabetes. I've heard the term diabetes distress. Can you tell our listeners what that might be?
I think that diabetes distress is probably best described as something that occurs when somebody feels overwhelmed by their diabetes. They do not feel that they have any capacity to care or manage it. I'm careful with the word control because it's difficult to control anything. I think I'd speak more about caring for something. I think diabetes distress can occur when somebody feels that it is taking up too much space in their psychological world or even in their physical world, and it becomes somewhat all-encompassing. I think in cases of diabetes distress, it is about breaking it down into pieces. I talk about, forming goals. So, a New Year's resolution, a person might be, I'm going to take better care of my diabetes. But break that down. What does that mean? Am I going to test 5 times a day? Am I going to attend my outpatient appointments? Break it down, because stress in and of itself gives us a bit of a movement, a bit of a lift to do things. But when there is too much to do, we get distressed. And diabetes, because it's quite a widespread condition, I suppose, there's lots of pieces. There's medication, there's diet. It feels like there might be too many things to manage. So breaking things down is really, really important. And I think another factor that probably isn't spoken about greatly, but does lead to distress, is the language that we use around diabetes. So you'll have heard me say, I don't like to talk about diabetes control. I'm more interested in words like diabetes care, because there are certain words that cause us to become a little bit more agitated, and that is what stress is to become agitated or distress. Things like a chronic condition, I think of it as an ongoing condition. Words such as, being motivated about diabetes. Maybe it's about committing to diabetes and staying connected. So in many ways, I think that the distress can be broken down into what is leading this person to feel like they can't manage their diabetes. And I think when somebody starts to manage the pieces, the perspective, the language, the daily activity that's involved in diabetes, that lessens the sense of overwhelm and brings their sense of they can do this actually from the inside out. Yeah.
And are there psychological factors that are directly related to diabetes itself? Are there changes in psychological well-being that can be expected, directly related to kind of high sugars or low sugars?
Yes,
can people expect those?
Yeah, I think that mood can be a part of that. I think when sugars are very high, there can be a sense of anxiety or a sense of, I suppose, hypervigilance. And I suppose when sugars are low, there's that fatigue, and maybe that may present a little bit as the likes of low mood or depression. And I think that's where having a team and a psychologist as part of that team highlights what might be physiological that is presenting as psychological, and equally what might be psychological that would be enhanced by some adjustments. So I do think that there are aspects of what is the causative factor of this presentation. And like that, the psychologist needs to work very closely with the nursing team or the doctors to understand what is the biology here as well. Yeah.
And what can people do? How can they access psychological support while living with their diabetes?
So there's the Diabetes Association of Ireland provide an awful lot of support. I know here in the hospital there's a psychologist as part of the diabetes team. But I suppose there's something about, understanding that psychological support comes in many forms. That may come from peers who have diabetes. It might come from a friend who doesn't have diabetes, but they're your watchman when you're out on a night out. So I think in some ways psychological support professionally is very appropriate and necessary, but it's also important to spread out where is that intervention that is keeping an additional eye on me while I'm going about my daily life. Yeah.
And I think listening to this particular podcast will also give our listeners some really nice information about the psychological factors and if they are experiencing those, what they may or may not do. I've enjoyed listening to you during this episode, but before I wrap up, I'm just wondering, is there anything further that you think our listeners could take away from this particular episode today? Any further points maybe that we didn't have a chance to discuss earlier?
One of the things I think that is really important and difficult in managing diabetes from a psychological perspective is the need to be flexible. Diabetes bloods are not definite. Depending on the day, depending on various different things, they will change. And I suppose I'd like to think of it as being like learning how to surf. Some days the waves will be small. and maybe not very much action, and other days there will be stormy seas. And I suppose there's something about that. How do you learn to ride that, where it is that you stay on the board, or if you fall off the board, you can get back on reasonably easily, that you're not getting blown around in storms all of the time. So I think there's something about flexibility is probably the word that I would leave this with, yeah.
Thank you so much to Noelle O'Keefe, Senior Counselling Psychologist from Tala University Hospital, for joining us today, and thank you for listening. This Let's Talk About Diabetes series has been brought to you by Tala University Hospital in partnership with the Healthy Communities Development section of South Dublin County Partnership. So that's it for this series. Thank you for listening to the TUH Let's Talk About Diabetes podcast. As you've heard in the series, there are a lot of resources available through your local chronic disease management hub from your GP or your practice nurse. You can search online at diabetesireland.ie for a range of resources and access to support groups and supported education. You can also find information on type 1 and type 2 diabetes online at hse.ie, as well as links to the services available to you and supports in your local area. Thanks again for listening. Let's talk again soon.